Raymer wrote a very important paper in 1997. Sometimes you say to me, well, Jim, some of these references are old. Well, of course they're old. Things that are right, they never change. For example, would you do away with Edgar and Park's research in 1934 when they found out that the pressure on the nerve was not a tumor, but it was a disc herniation? Okay. Would you do away with the late 1860s in which straight leg raise by Forrest was found? No. Some of these things live forever. Now, I will show you references that you haven't even seen yet. But remember that history teaches us so much, and Raymer was a great example of that, doctor. If you look at Pain Journal, volume 70, in the dorsal root ganglion who have chronic constriction of the dorsal root ganglion, what happened? There's an influx of sympathetic axons growing into the intervertebral disc from the dorsal root ganglion. So such irritation, such chemical or mechanical compression leads to what we call not only nociceptive pain, but neuropathic pain. Follows such chronic compression and ingrowth and hypersympathetic innervation of the intervertebral disc from the dorsal root ganglion. It is this increase in abnormal discharge of sensory neurons that occur from within the dorsal root ganglion, setting up this vicious circle of microvasculitis, ischemic hypoxia, ingrowth of sympathetic nerves into the dorsal root ganglion, into the intervertebral disc itself, which incidentally, the disc is the most pain-sensitive tissue in the low back. And we see this vicious cycle that chiropractors are immersed in when patients come into us complaining of spine and or radicular pain.